Hey guys, it's Daniel. Last week I made a video about my lower dysphoria, just to update you guys on where I'm at and what's been going on this summer. um, so today's video is about what I'm doing about it. Um, so lower dysphoria is like multifaceted. Some of it is just like grief over um, the past and what I didn't have. Um, like, I get really dysphoric thinking about growing up male and that I missed that whole experience, you know. Like, my daughter is starting to go through puberty, and so there's like, we got the books and stuff on it, and it's really, really hard for me to think about that. Um, because I missed I missed I missed what should have been, you know. Um, and then another part of like past dysphoria, things that can't be changed, is not being able to father a child. And I know I'm really lucky to have a biological child, because a lot of trans guys don't get that. Um, so I'm thankful for that. Um, but it's not how I wish it was, you know. Um, but then there's a lot of lower dysphoria that is like current, like happening now. Like uh, standing to pee is a big problem. Not being able to. Uh, it seems like the further along I go in transition, the more that bothers me. And having, not having a package where it should be, having all my junk like hidden is a problem. And having female anatomy is very upsetting, stressful. So I've tried really hard to be happy the way I am, uh, because a surgery is kind of terrifying, and I hate that it takes a surgery to be comfortable. And then lower surgeries too, like it's not going to be like top surgery, you know, you get it done and you have a male chest. And other than the scars, which can be dealt with, it's a male chest, just like anyone else's. Whereas lower surgery, even after surgery, it's still not going to be like a cis male penis, because it's either going to be with a metoidioplasty, you're going to have your own penis and function like normal but be very small, or a phalloplasty, you can have full size but it's not going to naturally function. So you you kind of have to like pick one. uh, I definitely just simplified that big time, but you have to pick one and decide what is going to help you the most. Um, for me, that's going to be a metoidioplasty, even though it will be very small. What's really, really important to me, like I'm really attached to my little penis that I have. The way it functions, and I can't wrap my head around not having it. So, and also as far as donor sites, like I can't like imagine giving up the skin on my arms or my leg. I don't have the fortitude to go through that. Um, and metoidioplasty will give me everything I need. Standing to pee, fully functioning, um, the little package, so I don't feel so dysphoric like when I go swimming and stuff. Um, and it's not going to give me a penis big enough to have like regular intercourse with penetration. So I'm still going to have to use a prosthetic for that, and that's something that I have to accept, you know. But I guess even with a phalloplasty, you still have to use a prosthetic of some sorts, although it's right there, you know. It's you don't have to strap it on, so that part's nice. But I can handle that. I can handle that. Um, so anyhow, last year I had wanted a metallioplasty, and I'm there. I'm there again this year. So the steps to make that happen are a little different this year. Last year I was just trying to save the money and do it on my own. This year I'm gonna try to have insurance cover it. I have a friend who's a lawyer who's transgender who's passionate about healthcare coverage for transgender individuals, and she's gonna help me uh, make that happen. I mean, insurance laws are changing so rapidly, and I think that we can make that a possibility, which is I'm not very I don't have a lot of money, um, so that makes it a lot more possible for me. And my partner is very supportive, um, and she's helping. She's helped me. I don't know. I'm not sure what to say. Like, I have so much, like I talked about in my last video, like the guilt and the. She's helped me understand that it's okay to feel the way I feel, and to do what I need to do to be the man that I am. So, anyhow, it's really hard for me to talk about genitals. Like my whole upbringing, just it's so taboo. And here I am, wanting a penis of all things. But uh, it is what it is. Um, so anyhow, so what I've done now to help me move me toward metodioplasty is I obtained some DHT cream, because DHT can help your little penis grow, and when it's very small, every little bit helps. So I done some research on that and decided that I wanted to give that a try. So I'll make another video all about DHT, and I'll make sure to document that whole process, because it seems like I had a hard time finding very much information on it. I found a few guys who had started it and didn't finish it, and a couple guys that started it and used it and had good results. And so I definitely want to. There needs to be more information out there about that. So I'm gonna cut this off. It's almost 9 minutes, and I'll make another video about DHT. Thanks, guys.